If you have frozen shoulder, whether you're just diagnosed or you've been dealing with it for a long time, or if you're just frustrated by all the slow progress that you're making, well then you're in the right place. I want to talk to you about a new treatment option that can provide fast and significant pain relief. Let's learn about high volume capsular distensions. Dr. Jeff Peng here. I recommend my patients be extremely aggressive when treating their frozen shoulder. And that's because if it's left untreated, it can take up to 3 years for it to resolve on its own. What's worse is that some people can have persistent shoulder symptoms that can continue to affect their quality of life. Now, before we talk about how we can be aggressive in treating frozen shoulder, I just want to make sure we're all on the same page. What is frozen shoulder? Frozen shoulder is also called adhesive capsulitis. It results from scar tissue formation called adhesions that form around the shoulder joint. The scar tissue physically contracts the shoulder, and the contraction restricts range of motion. And that's why every time you move, you get pain. Now, frozen shoulder progresses through 3 phases. The first phase is the freezing phase. Now, this phase is usually the most painful, and it can last up to 9 months. The second phase is the frozen phase. Now, this phase is where people feel stuck. They have pain when moving their shoulder. The second phase typically lasts up to 12 months. The third and final phase is the thawing phase. This is where your shoulder slowly improves in terms of its range of motion and the pain. But this can also take up to 12 months. So now you can see why I recommend being extremely aggressive in treating frozen shoulder. Nobody wants to wait up to 3 years for their shoulder to thaw out. Aggressive treatment can significantly speed up the timeline and shorten the duration spent in each phase. So what is this new treatment option, and why do I recommend everyone who has a frozen shoulder consider getting it? The procedure is called a high volume capsular distension. It is a minimally invasive ultrasound-guided injection used to treat frozen shoulder, and clinical trials show significant improvements in terms of pain relief and functional improvement. Under ultrasound guidance, a mixture of anesthetic solution is introduced into the shoulder joint. Once the joint is numb, a large volume of sterile saline solution is then injected into the shoulder. The pressure of the fluid distends that shoulder joint and puts outward pressure on all of that scar tissue. As more and more fluid is infused into that joint, those adhesions are stretched to the breaking point and they often rupture. And what's really amazing is that rupture can actually be visualized under ultrasound and results in immediate improvement in range of motion and mobility. The most recent clinical trials have confirmed that high volume capsular distensions are an extremely effective treatment option for frozen shoulder. This systematic review and meta-analysis looked at all non-surgical treatment options, which include but are not limited to oral medications, home exercise programs, physical therapy, acupuncture, steroid injections, and capsular distension. The researchers found that capsular distension was the best treatment option for pain relief. They concluded capsular distension is a highly recommended choice for the treatment of frozen shoulder, contributing greatly to pain relief and functional improvement. Here is my typical treatment plan for people with frozen shoulder. I immediately start patients on a home stretching regimen. This needs to be done a minimum of 3 times per day. Stretching throughout the day puts traction on that scar tissue, which over time will slowly improve range of motion. I ask my patients to see a physical therapist to establish care and get a baseline. We then schedule a visit together to perform an ultrasound-guided high-volume capsular distension procedure. During the procedure, I am able to visualize the distension of the joint capsule as well as the rupture of that scar tissue. Immediately after the procedure, and while there is still a lot of numbing medicine in that shoulder joint, I perform joint mobilization and manual therapy. The local anesthesia in that shoulder joint allows us to be fairly aggressive in mobilizing the joint. Within 2 hours after the procedure, I then ask my patients to go to physical therapy to continue working on manual therapy and joint mobilization. They continue to go to physical therapy twice a week as well as work diligently on stretching every single day at home. Patients and physical therapists have been amazed by the progress and results that this treatment plan offers. It avoids the need for surgical intervention such as manipulation under general anesthesia or arthroscopic surgery. Please share this video with anyone you know who might have frozen shoulder. This is a new type of procedure, and the more people who learn about it, the more people who can benefit from it. Please also consider liking the video and subscribing to my channel. You can find me on social media. I'm on Twitter at Peng MD. I also write on my blog at jeffreypengmd.com. Thanks and see you next time.